Hello everyone, my name is Andrew Quinlan. I work here at Faith in Motion, and today we're going to be talking about knee pain. Knee pain is a pretty common injury that we see quite a bit. There are a few different types of injuries that we typically see on a day-to-day basis here. So we're going to kind of go over that a little bit today. So when we're talking about the knee and the anatomy of the knee, there's a lot going on there. So there's a lot of muscles that kind of help attach out the knee with tendons. There's a lot of ligaments, cartilage, tendons, all kind of stuff in there, and all that can be a different factor as contributing to that knee pain that you're talking about. So what we're talking about today is there's 4 different types of muscle groups that we're going to go over. So quadriceps, or the kind of muscles in the front. You got your hamstrings, you got your adductors, which is like your groin muscles, and then you got your abductors, which are more on the outside of your hip. You also have ligaments in the knee that kind of help with knee stability. So you got your LCL, your MCL, ACL, which you probably heard of before, PCL, and then you got your meniscus. And then you also have some tendons that attach in there that can cause a lot of knee pain. So you got your patellar tendon. With that, you have your quad tendon. You have your iliotibial band, which is a tendon. IT band syndrome is probably what you've heard. So one of the main injuries that we see in the knee is going to be knee instability. And there are a lot of different factors that can lead to knee instability. One being injuries at the hip, also can have some injuries at the foot or issues at the lower foot that can cause a lot of that knee instability. So we'll kind of go over that a little bit later in the video as well. The signs and symptoms of knee instability is you're going to have pain and swelling kind of overall after activity or even during activity. You're going to notice some difficulty walking on uneven terrain. You feel like the knee might be giving out. You'll have difficulty kind of walking up and down stairs or up and down hills, and you'll feel like your knee is going to give out. So our next most common injury that we see a lot in the clinic is a tendonitis injury, which is usually an overuse injury of the tendons, especially in the knee. So the 3 major tendons that we see this with is patellar tendonitis, quadriceps tendonitis, or even IT band syndrome is just inflammation of the IT band on the side here. Signs and symptoms that you'll see with that is you'll have some irritation with activity, especially starting out with activity. You'll notice that it kind of eases up as you get through your workout, as you warm up a little bit, but then you'll start to notice it comes back as you start to cool down, or later that night, or even the next day. You'll also have some point tenderness, some reduced range of motion. You might see that it's tender to touch, or it'll be kind of discolored, so it might be bright red, or overall just kind of puffy and swollen. So the last injury that we'll talk about that's pretty common, especially in the older population, is osteoarthritis. What that is breakdown of the cartilage in between your knees, keeping it from grinding. So what you'll see is you'll have some puffiness and swelling, pain while walking. You might hear or feel like a grinding type of feeling. You'll have difficulty walking for long periods of time. You might have some issue walking up or down stairs, and then have difficulty exercising or doing the activities that you like, with some pain going on with that. Biggest thing with osteoarthritis is a lot of people, because it hurts so bad, they want to just rest on it. Best thing for osteoarthritis is to keep moving as best you can, as long as the pain will tolerate it, which will help kind of keep your strength up. It'll help reduce the pain overall, and then making sure that you're treating it afterwards with ice or anti-inflammatories, whichever you prefer.
If you found that you are kind of falling into one of these 4 categories of shoulder pain, your next question is probably, well, what do I do now? Who do I go see? How do I solve this shoulder pain? So here at Faith in Motion, we follow a simple 3-step process to get you out of pain and back to doing the activities you love. Our first step is going to be manage. We want to manage your pain and get it under control as quickly as possible. We know that when you're in pain, you're not your best physically or mentally, and you're not able to do what you want to do. So we use a lot of hands-on techniques early in the rehab process, whether it's stretching, massage, or different modalities like cupping, dry needling, acupuncture, that help get your pain and inflammation under control so we can move on to step 2. Step 2 is going to be mend. We like to mend, or what we say is fix the root cause of the issue. Oftentimes, the area that you're experiencing pain may not be the root cause. So that's why I said you have to work with a clinician that can really dive deep and find the root cause of your issue. We're movement experts here at Faith in Motion. So we test the joint that you are coming to us and complaining about, as well as joints above and below it. We break down your movement, and we really find the root cause of what is happening. So during this mend stage, we will start to incorporate corrective exercises They're kind of low level, easy exercises to start undoing some of those root causes of that pain. And then thirdly, which is what we think is the most fun stage of rehab, is the move stage. So once your pain is under control, we started correcting some of those underlying issues. We really want to build you up and get you strong and confident in this stage. So once your pain's under control, we've corrected some of those underlying issues, we're going to load you appropriately, make you strong, and get that joint resilient so you don't get hurt again and you don't need to come back and see us. We want to help you achieve your goals as quickly and as healthily as possible and to stay out of pain long term. If you would like to talk to one of our clinicians or expert in shoulder pain and learn more about our 3-step process and how we can help you solve your specific shoulder pain, book a call with us today to get started.